Intertrochanteric fractures is one of the common cause of morbidity and mortality in the geriatric age group. With improvements in standard of living and longevity, this fracture is being increasingly encountered. It remains the most common cause of hospital admission in an elderly. And another common condition associated with decreased quality of life is osteoarthritis of knee joint. This has a bearing on overall mechanical alignment of the lower limb. Both these conditions cause significant financial burden on the healthcare system. There are many studies which have shown the outcome of intertrochanteric fractures, like whether with regard to the type of implant, whether it is intramedullary implant or extramedullary implant, the type of fracture, the grade of osteoporosis, and the pre-fall ambulatory status. There are few studies which have shown that knee joint degeneration could promote hip fracture, but not due to fall. Knee joint degeneration, it has been theorized that knee joint degeneration, the lines of force changes, the hip anteversion changes, the knee flexion deformity occurs, the muscle limb, lower limb, the power of the lower limb muscle changes, and these all has a bearing on overall mechanical alignment. Our study shows compares the functional outcome of surgical treatment of intertrochanteric fractures in osteoarthritis knee and non-arthritic knee. Materials and methods. Ours was a cross-sectional study at our tertiary care center, of which we had 120 patients, the range of the patients being 50 to 93 years, and the mean age being 67 years. And all our patients had undergone osteosynthesis for intertrochanteric fractures, and they were assessed at 6 months and 1 year of follow-up. We had divided our patients into two groups. The group A, the non-arthritic knee, the Kellgren-Lawrence 0 and 1, of which we had 40 patients. And the group B, we had arthritic knee, the KL grade, the Kellgren-Lawrence grade 2 to 4, of which we had 80 patients. Mind you, in both the groups, we have matched the patients in terms of the type of fracture, the type of implants, the grade of osteoporosis, and the pre-fall ambulatory status. Both these groups had equal number of patients, equal grades. We have matched both the groups. And the outcome was evaluated in terms of hip pain with regard to the visual analog score and the functional outcome with regard to the Harris hip score. And with the relation between the KL grade and the Harris hip score, we could show that there was a declining trend in Harris hip score with every increase in KL grade. There are 4 grades in Harris hip score. We could find the poor Harris hip score, that is the score of less than 69, to be more in the patients of the KL grade 3, 2, 3, and 4, which we had considered as the arthritic knee. Then the non-arthritic knee, the 0 and 1, which has no complaints of knee pain and no joint space narrowing with an osteophytes. And further, in the two groups which we had divided, the 0 and 1 grade and the 2 to 4 grade, we could show that Harris hip score was poor in the arthritic group, that is the 2 to 4 group. So there was no statistical significant correlation between the age of the patient and the post-operative Harris hip score, the p-value being less than 0.001, and there was no significant correlation with respect to intramedullary or extramedullary implants at a follow-up of 6 months and 1 year. The study has shown that PFN was a better with regard to in the early studies, but over the long-term follow-up of 6 months, and the intramedullary and extramedullary both have the same outcome. And we could show the declining trend in Harris hip score with every increase in KL grade. And we have seen that a poor Harris hip score was seen in 15% of the group A patients, that is the non-arthritic group, then in 40% of the group B, which is the arthritic group, which was statistically significant. So we conclude that osteoarthritis knee has a negative impact on the functional outcome of intertrochanteric fractures. There could coexist a correlation between the knee joint degeneration and the hip fracture in intertrochanteric fractures. Thank you.